The Ohio State University College of Pharmacy, coming to you today from Columbus, Ohio. We are part of the American Pharmacists Association Academy of Student Pharmacists. Thank you for taking the time to view this short video demonstrating the vital role that pharmacists play in the healthcare team. Pharmacists ensure that medication therapy is safe, effective, and patient-centered. Let's take a look at a few pharmacist-patient interactions, such as medication therapy management, or MTM, and prevention services. Every day, pharmacists across the nation provide medication therapy management services, also known as MTM. These face-to-face patient-pharmacist interactions reduce healthcare costs, improve patient compliance, and result in better health outcomes. A community pharmacy MTM typically includes the following core components: medication therapy review, and creation of a personal medication record and medication action plan. Following an MTM, pharmacists make appropriate interventions and/or referrals, as well as document and follow up with patients. Here is an example of an MTM. Hi Bridget, my name is Anna. I'm a pharmacy intern here. How are you doing today?
Oh, I'm doing well. How about you?
I'm doing good. Do you have a few minutes, 10-15 minutes, to go over your medication today?
Yeah, that'd be fine.
Okay. The first one looks like it's St. John's wort.
Yes.
Okay.
Yep, that's, I just buy that. I don't get a prescription for that, though.
It's just over the counter.
Yeah.
What do you take that for?
For depression.
Okay. And was this something that was recommended by a physician?
Actually, a friend.
It also looks like we have a Pro Air inhaler here.
Yes, that's,
Okay.
I guess that would be what I use when I really can't breathe.
Okay.
If I feel like extra, tightness in my chest. So it's not something I use all the time, but.
All right. How often are you using it currently?
Currently, probably more like, a couple puffs every couple hours.
Okay.
Yeah, I didn't bring my my birth control.
Birth control? Okay.
I don't know. I think it's Yasmin or something like that. They have those commercials sometimes.
Okay. Yasmin, yeah, it's pretty common. And do you take that regularly?
Yes. I have my alarm set on my phone for it.
Okay. Bridget, I took all the information you gave me about the medications you're on,
Okay.
and I've created for you a medication record.
All right.
It gives all the medications you're on, your dose, and what you say you're taking them for, how often you're taking them. I also included over here the physician that prescribed them. I also created for you a medication action plan. I noticed when I was going over some medications, there's some potential interactions.
Oh no.
Yeah. One of them is pretty significant. It's an interaction between St. John's wort and birth control that you're on, Yasmin.
Okay.
St. John's wort can actually decrease the effectiveness of birth control.
Well, that's not a good thing.
That's not a good thing, no. So at this point, I would recommend discontinuing the St. John's wort.
Okay.
And scheduling a follow-up visit with your physician to find a different treatment for depression. And then another thing I put on here is you had mentioned you're using your albuterol or Pro Air.
Oh yeah, a lot.
Frequently. So it seems to me that maybe your asthma is not quite controlled. You think it is?
It's kind of annoying to have to use it all the time.
And
So
feeling like tightness and shortness of breath.
Yeah.
There are plenty of other medications out there that can better treat the asthma. So I'm going to recommend that you make an appointment with your primary care physician.
So should I take this with me maybe when I see my doctor?
Exactly.
Okay.
And this will tell you exactly what to talk about with your physician.
Good, because sometimes I feel so rushed and I don't know what to say.
Yeah, this will help you kind of organize the meeting. So that's a lot of information we covered today.
Yeah, but I'm glad that I have these,
Yeah.
kind of guidelines for me.
So if you have any other questions, our number is written up here at the top. So feel free to give us a call.
Okay.
We're here to answer your questions about any prescription medication as well as over-the-counter.
But I'm really glad that you were able to take the time to talk to me, though, because, like I said, someone just recommended the St. John's wort, and I didn't realize the interaction. So I appreciate it.
Oh, you're welcome. That's what we're here for. And like I said, call us if you have any questions.
Okay.
Thanks for coming in.
Thank you.
This was just one example of medication therapy management. Such services are essential in a healthcare system that spends $177 billion in treating adverse events from improper medication use.
Pharmacists are the most accessible healthcare professional. As a result, pharmacists are an untapped resource to provide immunizations, screenings, and patient education. Throughout the 6 to 8 years of pharmacy education, pharmacy students actively engage their communities by assisting current pharmacists in providing these prevention services. Immunizations can be provided conveniently in a community pharmacy setting and can include influenza, pneumonia, and meningitis, among many others. And screenings such as blood glucose screenings and blood pressure screenings increase awareness of preventable diseases. As medication experts, pharmacists are essential to the healthcare team. As healthcare reform takes shape, we urge you to include recognition and appropriate compensation for pharmacist-provided services in any healthcare legislation. As many studies have shown, pharmacist interventions can reduce costs, improve outcomes, and save lives. Thank you for taking the time to view this video.